Welcome to the deep dive. Today we're exploring something truly mind-bending, auto-brewery syndrome. You might have heard it called gut fermentation syndrome. Our mission is to really get under the hood of this condition using a fascinating recent case report. We're talking about how someone can get, well, legally drunk, sometimes severely intoxicated without actually drinking any alcohol at all. So at its heart, ABS, it's like a glitch in your body's chemistry, right? Where the carbs you eat, think pasta, bread, sugars, they get fermented inside your own gut by fungi.
Yeah, exactly. Producing ethanol, your digestive system essentially becomes its own little unregulated distillery.
Yeah.
And what's really striking, it's not just the biological mechanism, it's the fallout, the medical side, obviously, but also the social consequences. It's diagnosed so rarely. Doctors often just, they dismiss it. But it brings all the problems of alcoholism, memory loss, aggression, mood swings, and critically, things like DWI arrests, driving while intoxicated. So we're going to follow the journey of one man, 46 years old. His case really highlights the struggle, the denial from others, and finally getting answers.
Okay, let's jump into that case history then. It sounds almost unbelievable. This was a guy, 46, previously healthy, active, and then suddenly, January 2011, things go sideways. He starts having serious memory issues, what he called brain fog, feeling depressed and having these bursts of aggression, totally out of character for him. And if you look for a trigger, a starting point, the sources seem pretty clear. It all kicked off about a week after he finished a 3-week course of antibiotics.
Ah, the antibiotic connection.
Yeah, cephalexin. He took it for thumb injuries.
Yeah.
A serious one, apparently.
Right, and cephalexin, that's a broad-spectrum antibiotic. Very common, very effective for infections, but taking it for 3 weeks, that's significant. It basically acts like a reset button for your gut microbiome, but not in a good way. It wipes out loads of beneficial bacteria.
The good guys that normally keep fungi in check.
Precisely. So it creates this vacuum, and opportunistic yeasts, fungi, they just seize the chance to grow unchecked. And that starts the fermentation engine.
And the immediate result of this internal brewing was, devastating for him socially. He got arrested for DWI.
Despite swearing he hadn't had a drink.
Exactly. He insisted he hadn't touched alcohol, but his blood alcohol level, his BAC, it came back at 200 milligrams per deciliter.
200, which is just astronomical.
Yeah, let's put that in perspective. The legal limit for driving is usually around 8 milli-GDL. He was 25 times over the limit.
So you can understand, perhaps, why the police, even the hospital staff, they just didn't believe him. It sounds impossible.
How could they?
It really wasn't until he sought help elsewhere, ended up going to Ohio, I believe, where some doctors were maybe more familiar with these kinds of unusual cases. His aunt actually bought him a breathalyzer so he could monitor himself. And sure enough, it showed high readings at random times, completely unrelated to drinking anything.
Okay, so that's some objective evidence, finally.
Yeah, and to confirm it formally, they did this initial challenge test. Under observation, they gave him a carbohydrate meal, about 50 grams.
Like just some bread or something.
Probably something simple like that, yeah.
Wow.
And then 8 hours later, they checked his blood alcohol. It had climbed to 57 milligrams per deciliter. That pretty much sealed the deal. It confirmed his body was making alcohol from food.
Okay, so confirmation, finally. But like you said, that's just the start. Now they had to figure out what exactly was doing the brewing inside him.
Right. You need to know the culprit organism to treat it effectively. So those initial tests in Ohio, the stool samples, they found Saccharomyces cerevisiae.
Which is baker's yeast. Brewer's yeast.
That's the one, a very common yeast.
No.
They also found Aspergillosis, but treatment based on that wasn't fully successful. He relapsed quite severely, actually.
And they needed to dig deeper.
Exactly. Later on, when he was treated in New York, they used a more direct approach, endoscopy. They collected fluid samples directly from his upper small intestine and his cecum.
Going right to the source.
Yeah. And those samples revealed different yeasts, Candida albicans and Candida parapsilosis. These are often more pathogenic species.
And finding them high up in the small intestine? That is not normal, is it?
Not at all. Normally, fungi, if present, are mostly kept down in the colon, the large intestine. Finding high concentrations of Candida in the stomach and upper small bowel, that's a strong sign of pathology.
It means they're actively fermenting carbs way earlier in the digestive process than they should be.
Spot on. Where digestion, not fermentation, should be happening.
And looking at other ABS cases in the medical literature, this patient seems a bit different, right?
He does. Most previously reported cases involve people who were already quite ill. maybe severely immunocompromised, or they had physical issues in their gut, like strictures from Crohn's disease, or maybe short gut syndrome after surgery, things that disrupt normal gut flow.
But this guy was healthy before the antibiotics.
Pretty much, yeah. And that's what makes this case medically significant. The strong link between that cephalexin course and the start of his ABS in an otherwise healthy person, the sources say that specific sequence hadn't really been documented before.
So it's a serious warning about antibiotics, potentially.
It certainly raises questions about the long-term, sometimes unexpected effects of disrupting that delicate gut ecosystem.
Okay, so they've confirmed it, they've identified the candida.
Yeah.
But you mentioned his recovery was tough, with relapses. Let's talk about the treatment path. Why was it so difficult?
Well, the first approach was twofold. Starve the fungi with a strict carb-free diet.
No fuel for the fire.
Right. And attack them with oral antifungal drugs. They tried fluconazole first, then the statin.
Did it help initially?
Partially, yeah. Symptoms improved for a bit, but then they just flared right back up. This thing was incredibly stubborn.
And the relapse you mentioned was severe.
Extremely. During one episode where his body was producing a lot of alcohol, he got severely intoxicated, fell, and actually hit his head hard enough to cause intracranial bleeding, a brain bleed.
Oh my God. That's terrifying.
It is, and during that hospital stay, his BAC levels were all over the place, sometimes down to 50, but at other times peaking near 400 milligrams per deciliter.
400. Even with doctors knowing about the ABS diagnosis.
Even then, it was just so hard for the medical team to square what they were seeing, this apparently non-drinking patient with these sky-high alcohol levels. The mistrust must have been immense.
Absolutely devastating. So what finally worked after they found the candida?
They shifted to a different oral antifungal, itraconazole, but then another setback. He had a bad relapse, and it turned out he'd eaten pizza and had some soda without telling the doctors.
The perfect storm of carbs.
Exactly, fueling whatever fungal colonies were left. So that taught them two things. Diet adherence had to be absolute, at least initially, and maybe more importantly, the oral drugs just weren't cutting it. They weren't clearing the infection fully.
Why not? Why wouldn't the oral pills work if they target fungi?
Well, the thinking is the oral antifungals like fluconazole or itraconazole, they get absorbed, go into the bloodstream, but maybe they don't reach high enough concentrations back into the mucus and secretions lining the upper gut.
Yeah.
Especially if the candida has formed protective biofilms.
Oh, okay. So it couldn't get to where the problem actually was.
Potentially, yes. The breakthrough came with intravenous treatment. 6 weeks of IV micafungin.
Micafungin. What's different about that one?
It's a different class, an echinocandin. And giving it intravenously bypasses all those absorption issues. It guarantees high, sustained levels of the drug throughout the body, including penetrating those gut tissues effectively.
Basically flooding the system to wipe out those deep-seated colonies.
That seems to be what worked. After the 6 weeks of IV micafungin, they did another endoscopy. Clean. No fungal growth detected. And the report says he remained symptom-free 1.5 years later. He could even eat a normal diet again.
That's incredible. A long road, but a successful end. What about diet and probiotics during all this?
Well, that strict carb-free diet was crucial early on to stop feeding the fermentation. As for probiotics, there isn't much formal study on them for ABS specifically, but they were used here. The idea was competitive inhibition, trying to bring back the good bacteria that the cephalexin wiped out to help crowd out the fungi.
Makes sense.
They started with just one strain, Lactobacillus acidophilus, and later switched to a multi-strain, purely bacterial probiotic, trying to build back that diversity.
Given how long this took, the DWI, the near-fatal fall, it really underscores the need for better, faster diagnosis, doesn't it? Why do the experts think ABS is still missed so often?
It really comes down to that disbelief factor, that default assumption of closet drinking when someone has a high BAC. People just don't think endogenous production is possible. That's why the authors of this report are pushing hard for a standardized diagnostic test. A big improvement on that initial sort of ad hoc 50-gram carb meal he got in Ohio.
Because 50 grams might not be enough or the timing might be wrong.
Exactly. Different fungi ferment at different speeds, so the proposed standard test is more rigorous.
Okay, what does it involve?
It's a 200-gram glucose load given orally after an overnight fast, so a big sugar hit. Then, blood tests for both glucose and alcohol levels at very specific times. 0 time, then half an hour, 1 hour, 2, 4, 8, 16, and crucially, 24 hours later.
24 hours. Why so long?
Because some of these fungi, particularly virulent candida, can be slower fermenters compared to, say, brewer's yeast. They might take much longer to convert that big glucose load into detectable ethanol. You need that long window to catch them.
Okay, that makes sense. Catch the slow burners too.
Yeah.
And this ties back to the endoscopy, right? Getting those direct samples.
Absolutely. The authors strongly recommend using endoscopy both upper and lower to get fluid samples directly from the stomach, small bowel, colon. You then culture those samples, identify the exact fungal species, and test them for antifungal sensitivity.
So you know precisely what you're fighting and which drug will work best. No more guesswork.
Exactly. It allows for targeted therapy, like using that IV mycofunge instead of just trying broad-spectrum orals that might not work. It's about precision medicine, really.
And what about ongoing management? Like the breathalyzer, his antibot.
Yeah, self-monitoring is important. Breathalyzers are much more available now, which helps. But the key thing is accuracy. They need regular calibration or even replacement, maybe every 30 days, to make sure the readings are reliable. The patient has to be an active partner in managing this.
This whole story is just fascinating. It really bridges gut health, microbiology, even legal issues. What's the main takeaway for someone listening to this?
I think a key point is how ABS often shows up first. It might not be obvious drunkenness initially. It could be those more subtle, creeping psychiatric symptoms, the mood changes, the delirium, that intense brain fog the patient described.
Which means doctors need to think broader.
Yes, and involve multiple disciplines early on, including psychiatry. But fundamentally, this case confirms that alcohol is alcohol, toxic is toxic. Whether you drink it from a bottle or your gut brews it from bread, the effects on your brain and body are the same.
Right.
So any patient who denies drinking but has high alcohol levels, especially if they've been arrested for DWI, they must be investigated for ABS using these better standardized methods.
Absolutely. It's a diagnosis that needs to be on the radar. And the whole thing started with that antibiotic disrupting the microbiome. Which leads to a final thought, maybe. Well, getting the gut back to normal after all that, the initial antibiotic damage, then the fungal overgrowth, then the strong antifungal treatment.
Yeah, it's complex, right?
Very complex. The authors mentioned something about future studies looking into fecal microbiota transplantation, FMT. Could that be a way to kind of permanently reset the gut ecosystem?
Yeah.
Transplanting a whole healthy community of bacteria.
That's certainly a provocative idea. It's being explored for other conditions linked to microbiome disruption, like C. diff infections. For ABS, especially cases triggered by antibiotics, FMT might offer a way to establish a robust, competitive bacterial environment that prevents fungi from taking hold again.
Something to keep an eye on for the future, then. A potential definitive fix for this very strange internal brewery.
Definitely something worth investigating further.
For more information, case studies, and to make a donation, go to www.autobrewery.info.